evening, and welcome to the third episode in our Women in Health series brought to you by Cleveland Clinic Abu Dhabi. The episode today is entitled Getting Your Worth, a Practical Approach to Negotiation for Women. My name is Pascal Anglade. I'm a consultant gastroenterologist at Cleveland Clinic Abu Dhabi, and I also serve as the medical director for the Office of Professional Staff Affairs, also at Cleveland Clinic Abu Dhabi. And I am privileged to co-host this seminar with my colleague.
Hello, I'm Sosan Abdelrazik. I'm the chair of medical education and a consultant hospitalist here at the Cleveland Clinic Abu Dhabi. It's really exciting to be here.
Great. We're so delighted to have you with us tonight. So negotiation is obviously an extremely broad topic that we wouldn't imagine being able to cover within an hour, right? Entire books and courses are dedicated to this topic. But what we are hoping to do today is to give you a very practical and illustrative approach to negotiation, keeping in mind the mid-career professional, right? Who's tends to be at this tipping point or inflection point in her career, where really knowing how to negotiate at those tables really can truly be the difference between your career taking off or staying where it's at, right? So we've added a little bit of a twist for those that have participated to our webinar in the past. We've added a little twist in that at the end, there will be a segment highlighting a women's health issue as well as a leader in healthcare. So please make sure that you stick to the end of this webinar to be able to take advantage of that segment as well. How? And so we start.
Yes.
So we've decided to start with this first image, which is really the cartoon. And what do you bring to this company? And I think we chose to perhaps you go back one image, please. The reason why we chose to open with this specific image, it's because it really evokes a lot, right? So what, I see this and how does it make me feel?
So I have to say, me seeing this image really spoke to me. As a woman who has been on that negotiating table before, I think it really illustrates how lonely it can be, how intimidating it can be. And the fact that at the end of the day, you're sort of, you feel like you're there trying to sell your value to people who may not quite see it right off the bat.
And there's a clear authority or, differential in that picture. She's there sitting alone in front of all these people on the other side. I mean, you really feel for this person. You feel that this is not a comfortable situation. It's anxiety provoking.
Absolutely.
And so we decided to open with this image because as all these emotions that bubble up when you see it, what we'd like to do in the next hour is to completely change these emotions that are brought up by the image. And at the end of this hour that we'll have together, I'm hoping that you look at the same image as really completely something different, as really an opportunity, and really an opportunity to be at that table with the understanding that that table is really where the game is played and that you can actually play the game very well.
Yeah. So if we think about, well, where are those emotions coming from when you see that sort of image in your head? And why is it so particularly difficult for women to be at that negotiating table? I think it comes and it stems from this sort of vicious cycle that we put ourselves in. We innately feel that we're just not good at negotiating most of the time. In fact, some studies have shown that women compare being at that negotiating table as the same as going to the dentist.
Never a pleasant experience.
Which is not often all that pleasant. But the idea again is that if you walk into that room, essentially on that back foot, you sort of put yourself in this sort of self-fulfilling prophecy, and you end up leaving, one being more likely not to be as successful, and two, leaving with just an additional chip on that shoulder, which actually influences the next table,
right? Absolutely.
The next table. And so I think it's really, really important to absolutely change that mindset. And one of the key ways to do that, as we've known again in the literature, is actually using a reframing approach, right? So looking at reframing the entire scenario, right? From that of an area of weakness to recognizing actually that it's actually oftentimes an area of strength for women. Negotiating is not something new. What I love, by the way, when I'm gonna take it aside. One of the when thinking of reframing, one of the interesting things that I've come across about reframing, really at a workshop that I attended a couple of months ago, was about a small island. I don't remember where, it may have been Seychelles or Mauritius, but somewhere in the Indian Ocean. And their thought was, well, how do we put ourselves on that map as a small country or island in the middle of an ocean? And in fact, the idea came in reframing, and the reframing exercise was, well, actually, we're the largest ocean state, right? And so thinking about, how do we look at that negotiating table for women a little differently? Yeah. And I have to say that we have to recognize as women, we're negotiating all the time, right? We're negotiating all the time. We're negotiating on behalf of others all the time, right? We're negotiating on behalf of our kids at school. We're negotiating, when we enter a marketplace, we're negotiating, we're bargaining, we're negotiating on behalf of other team members at work for resources and for so many different things. And so when you think of it that way, you realize that we're actually quite good at it. And when you realize and you believe that we're good at it, then that scenario no longer becomes one of fear, right, or anxiety.
It's no longer daunting anymore.
It's no longer daunting, and I think what happens is the reason why we're not actually recognizing that is because we don't actually name these transactions in our day-to-day life as negotiations, right? We think of them as decisions or multitasking or whatever it is that we say. But actually, it's a form of negotiating, right? So just renaming and reframing that dynamic is extremely empowering. And so that's sort of what would really differentiate that or empower us in that particular transaction. So having said that, at the very least, if hopefully it empowers you a little bit, but at the very least, if you're able to see yourself as at least equal to that other person at the table, you're at the very least, if you don't get what you want, you won't leave with something that you don't want, right? And that's key,
really important,
because as we know, again, from the literature, many women don't even negotiate, and oftentimes they end up with things that they don't necessarily want or anticipate. And so that in and of itself is a form of success. So walking into that table and saying, you know what, at the very least, if I don't get what I want, I'm not going to leave with something I don't want.
Absolutely. So then the next step becomes, how do you get prepared? So when we think about a negotiation, if we think of it in analogy as being a game, right? Nobody walks into the game unprepared and having not, worked out it prior. So there's a whole pre-game work that needs to go into being ready for a negotiation and really walking in with the confidence and the knowledge to do well. So here, I really want to talk about that pre-game work, what you're going to have to do prior, super important before you get going. So because Dr. Sasson has already told us that we're good at this, right? So we're confident, but we still have some work to do. So the first step in setting the stage in your mind is to really depersonalize the process. So at some point in the negotiation, at any table that you sit at, some comments, something will be thrown your way that you may find, personally difficult to swallow, be it you're flustered, it ruffles your feathers, you may be insulted. And the important point here is to realize that this is part of the process. And this has really nothing to do with you or your intrinsic value.
It is a rite of passage.
It is. And everybody who's ever gotten anywhere in life has gone through that process as well. And it's that realization that everyone goes through it. It's not you. You just need to sort of remove that emotion. So when those comments are coming your way, you're like, okay, I was expecting it. It's part of the process. So really the first step is depersonalizing.
Which is a tough thing, honestly.
Not easy to do.
But of course, just knowing that it's not personal, like you said, is a step towards depersonalizing.
Yeah, absolutely. So that's really the first step in setting that stage in your head before walking in. And now the second important step is to do your homework and sort of really know your value. And although it sounds odd, I feel like, everybody knows what they bring. Well, it's really important to be able to articulate what is the value that you bring in clear, explicit, and concise terms, right? So that you come with an already packaged sort of idea, or to say, this is what I bring to your team, the enterprise, the whole organization. This is the value that I bring.
Right.
And for you to be able to assess that value, it's really important to understand the context. And I want to take a moment here to highlight something that I think is really important. And maybe it's a future webinar that we haven't done yet, a future episode, but this is where networking becomes really, really, really important as a way for you to obtain valuable information. Mm-hmm. So as women, we network well. We may not call it networking, but we
form relationships.
We form relationships well, right? We in the personal realm, in the professional realm, we form relationships very well. But oftentimes we don't feel or we don't know how to use those relationships to obtain information. And again, I want to be clear, we're not talking about divulging state secrets here. We're talking about information that is useful in a day-to-day conversation that may be useful for you to better understand the stakeholders that you're discussing things with, to better understand the context, understand the comparative, that people that may be a little bit like you in the organization, and you better understand that data. And for you to extract this, that information is really crucial. So it is important to see those relationships as useful. And I have to tell you that men do this all the time.
All the time. And I think, if you had to ask me, I think one of the problems is that we, as women, inherently feel that if we do that, it looks opportunistic and we devalue that relationship, or we make the other person feel that, we're using them in some way or form. And I think that's the piece that we can learn from our male colleagues really well, right? Because that's what's happening in golf, right? That's what's happening.
That's all of that's happening in golf, as far as I can tell.
So the question is, how do you do that in a way and feel comfortable about it, right?
Mm-hmm.
And that's and actually recognizing that oftentimes the relationships that you build, particularly around the professional sort of arena that you're in, oftentimes they have hidden value that you don't even know about, right? So if you don't open those conversations, if you don't, if you don't have that trusted network that you tap into, then you're right. Then you lose invaluable
information. So really, it's done with finesse, and realize that it's a two-way street as well, right? It's the information goes both ways. But I really do think that this is where we need to tap into those relationships a little bit more actively.
I agree. And I think those are all really important components of being able to state that value. Now it is nuanced, right? Because you might enter a conversation, where you already have a friendly boss, or the person at that table already knows your value. So in that case, you don't necessarily have to sort of restate it or push it. But the idea is in those circumstances where you do need to sometimes reframe that value, right? Because the person may know you in a certain context or for certain work, but you need to frame it sometimes in a way that would be beneficial to them. And that sort of leads me to the next point, which is really important in the pre-game work. It's the idea of knowing that other side, right? And so getting a sense, we already, as women, again, have an advantage. We generally have high emotional IQ. We're generally empathetic. And so the idea is using those or utilizing those in a way that is strategic, right? That leads to you understanding that other side better, right? And so I think, again, what is that, what are the constraints of that person across the table from you? Could there be something or obstacle stopping, whatever it is that you're asking for? Think about, how do I articulate my value, which is what Pascal said earlier. How do you articulate that value in terms that are impactful to that other person, right? So, and even if they don't see how impactful it is to them directly, it's about also seeing how impactful it might be to that level above them, right? So oftentimes, so being able to put that value proposition in terms that will make them also, in the case that you have someone who's already an advocate, right? So in the case of someone who does want you in that position, how do you give them that value statement in terms that the enterprise cares about, that their boss cares about, right? In other ways, because oftentimes they kind of, in that case, they may know you already, know your value, but you want them to be able to articulate it in a way that would be advantageous to you, right? So that's really, really important. I think another really important piece, again, in that pre-game work is thinking about the tactics, right? The tactical moves that you're going to make, the maneuvers, right? So thinking about things like, well, okay, what if my primary ask just doesn't go well, right? So thinking of that scenario, what if my primary ask doesn't go well? It doesn't seem to be moving forward. What are the alternative asks, right? What are the other things that I could be asking for? What are those low-hanging fruits in a conversation or in a discussion that may still be valuable to you, and you may still move forward with that opportunity, right? So things like negotiating work-life balance, or negotiating other forms of payment, right? Whether it's loan reimbursement or all these other forms or structures of payments, incentivized structures, but thinking about what are those alternate asks before, so that's sort of your plan B, right? That fallback, right? Well, if it doesn't work, if what I want doesn't exactly work, what are the resources I might ask for, the personnel, right? The other areas that might be domains for, a little more laxity, a little more wiggle room for that other person on the table. Sounds like you wanted to.
No, but I was going to say, realizing that a no here in that context may mean a yes somewhere else, right?
Absolutely. And I love no's sometimes,
so,
right?
Yeah, no's can be awesome, right? Because you get a no now, a yes is coming. The yes is going to have to come later on, and that's when you really make a separate, another
and that's
ask.
Another tactical move, which is the idea that human beings generally, at their core, want to care about fairness. They want to feel that they were fair, right? And so if someone says no, oftentimes that opens up a door to another yes somewhere else, right?
Down the line.
So again, using that tactically, right? So, okay, this is an ask that may or may not go through. But if it doesn't, then I'm going to bring up this other ask, right? And that's okay. That's okay to do that. So it's all about thinking about those tactics, right? The other piece is also a really important tactic is that BATNA, right? So having that BATNA, which is that best alternative to negotiating agreement, right? Which is essentially what is that card in your back pocket?
Yeah, exactly.
Right? Like what is that card? Like if all else fails, do I have a BATNA? Do I have another card there? It would be great if you did, and it actually obviously puts you in a more empowering position if you do. But if you don't, even knowing that you don't, right? If there really isn't a BATNA on the table, then the idea is that your bandwidth is a little bit wider for what you might accept, right? So knowing exactly what your strategic positions are, essentially walking in, is super important. And I'm going to go back to that vicious cycle for a second, because I think part of the reason why we feel so uncomfortable in certain areas, whether it's at the negotiating table or whether it's wherever else, anywhere. I don't want to be too, gender biased here with certain scenarios where women generally not very comfortable with. But the idea is oftentimes the reason why we're uncomfortable is because we feel not prepared, right? And so this pre-game work becomes extremely important for us, right? So because we feel more comfortable generally being equipped, and sometimes over-equipped, right?
Yeah, oftentimes over-equipped with knowledge.
Really important to have that pre-game work.
So you've done all the pre-game work. What is the next step, right? You've set up your mental stage, and the next step is really practice, which is a concept we understand well in healthcare. This is what we do to train and to get good, to get to zero harm. This is how we do it. We practice.
Right.
And how do we practice? And this is where we tie it back to the episode that we did last time about peer-to-peer.
Right. So peer-to-peer, right? Finding that trusted, close person who has your best interest in mind, who's able essentially to critique you critically, right? And provide you that insight, that sort of that look from the other side, to role play even, right? That negotiating table, right? That's extremely, we've done it for each other, right? So the idea is that, it is extremely important. And I have to say, of course, your friend is generally going to be gentler, but sometimes it depends who your friend is. But the idea is that absolutely just articulating and saying those words before you enter the room to someone else is so key. And then then learning, hopefully you're able to do some positioning in that role.
Yes. And practicing those pivots, those tactical maneuvers that Sausen told us about is going to be key within those.
Which we're going to get a chance to do today, actually, right? So at the end of this sort of first half hour, we're going to spend the next half really doing some
actual scenarios in practice. Absolutely.
So it's game time.
It is game time. You've done the work, you've done all the pre-work, and you're walking in and it's game time, and how you're approaching the game time. So we've already talked about the fact that you've got all the knowledge, you're ready. Now it's a question of how do you package it in a way that makes sense. So this is where we sort of look back at the literature to see what does research tell us about the way we as women need to approach game time when we walk onto the negotiation table. And this is where it gets a bit tricky, because the literature tells us that there's still a lot of different biases around women negotiating, right? We've talked about in our first episode, for those who were here before, we talked about when we discussed gender equity, we went through all the different gender biases that exist, but the one that I think is most pertinent to a discussion and negotiation is the likability bias.
Right.
The likability bias, which says that when a woman is more assertive, more ambitious, is a go-getter, she is liked a whole lot less. Right. And it is true that it is important to be liked by the person that you're negotiating with. Realistically, it is an important, and it's an important factor in making sure that you get what you want or you don't get what you don't want, right?
Right.
So it's important, and
it's a factor that's exaggerated for women, right?
Like, absolutely,
compared to our male
absolutely,
colleagues, right? So,
where they may be considered, a strong leader, where they're assertive. I may not be liked if I have the same approach or
right.
the same approach to negotiation. So this is where we have to go with what the literature and the research tells us. Mm-hmm. And how do we make our ask a little bit, how do we make ourselves more likable if we have an ask? And this is where you may consider going from I to we, so do a more of a communal type of negotiation. Right. So instead of having an I want this for myself, is, our team would really benefit from having that extra resources. And this is how having that extra resource will benefit the entire organization. Right. So having a much more inclusive and communal type of negotiation really makes a difference.
Right.
in actually
in the collective.
Yeah, talking in the collective.
It's the reality of at least the current world that we live in, right?
2021, yes.
Which, for better or for worse, the idea is that you want to use it at least so that it doesn't become an obstacle, right, to where where you want to get at. So yes, this collective language is extremely important. And not having that negotiator. So sometimes what happens is that other individual, if we'll say, okay, if we're a male, they may think, okay, I don't really like him, but I respect him for X, Y, Z, or their competence. With women, unfortunately, that doesn't happen sometimes. And there are studies that show that likability actually directly affects your pay, your compensation, right? From that particular negotiation, how successful you are in pay. So really, really important to keep in mind. So you're always balancing, right? This idea of
you're balancing, because you know that there is a social cost to coming out of that room disliked. Right. There is a social cost to pay, maybe even a monetary cost to pay, to be paid at a later time.
Absolutely. And you're balancing, between self-advocacy, trying to self-advocate, and at the same time not looking to self-centric in that process. So that's where the finesse comes in. Yeah. Right. That's where you, like you said, the language, the sort of putting it in terms of the enterprise, how do we, these skill sets of yours could benefit the enterprise in this way, or the organizations, or what have you, right?
And the other piece that comes to us more naturally, again, is sort of, you've mentioned it already, the EQ, the empathy piece, right? Where it's okay to empathize with the person you're negotiating with. And it's actually really a strength of ours. So I would put that in as one of the things that you want to be doing while you're asking. So, I realize that this may be a challenge for you, but I've thought that perhaps if we did it this way, it would actually be a very, better for you to sell it in that way. So again, empathize with the other side, and have more communal asks have been shown to be the most successful in terms of actually getting to your yes at some point.
So all great pointers, but as with any game, expect the unexpected.
Yes, always, right? Always.
So always expect the unexpected. Yeah. And so and this is sort of the next point here, which is as much as you're prepared and as much as you use tactics that might be helpful, there will be times, and it I'm sure all of you in the audience have gone through this, where something comes out of left field, a comment is said, or something is said to you that absolutely knocks you off your feet as someone very famous said, everyone has a plan until you get punched in the face, right? So the idea is, well, okay, how do you deal with that, right? Mm-hmm. How do you not get knocked off your feet? And oftentimes knocked off your feet for women is basically a loss of composure, right? And usually those statements, by the way, are statements that either question your competence, mm-hmm. question your value, or even question your character, right? So those are the comments that can be said indirectly or directly, right? That can absolutely, feel like a gut punch. Yeah. And in fact, so the first step when that happens is to recognize this as a classic power move, right? So this is a classic power move. This is meant oftentimes, well, sometimes it's just a snide remark from somebody who's not such a great human being, but oftentimes it really is a power move, right? Where that loss of composure doesn't allow you to think as tactically, yes, right? Yes. And in fact, not only doesn't allow you to think as tactically, may bring out, things that you may not want to say or do. So the idea is, the key to this is, one, anticipating it, right? Walking in knowing that after all this practice, it may happen. Because something is completely unexpected doesn't mean that it was a failure of negotiation, right? It's not a failed negotiation, right? It's just that something unexpected occurred. Mm-hmm. That's mm-hmm. number one. So recognizing it as a power tactic, recognizing that it's meant to throw you off. Mm-hmm. And then number two is maintaining, by all means, maintaining composure, right? So it's not so important what you actually say. In fact, just nodding your head might be something you do, but maintaining composure is really the key to dealing with those types of power moves. And of course, and I think this is something that's sometimes underutilized, is the idea that, well, if it really completely throws you off and you are really unable to continue in any way that's going to be productive, realizing early, and we should have maybe even said this in the beginning, that most negotiation tables are not just a be all and end all, like they're just there this moment, this 15 minutes, this half an hour, realizing that you can continue this negotiation, you can regroup and continue this negotiation at another time, right? Absolutely. Not to use a boxing ring, of course, analogy here, but just go back to that corner, get your wounds mended, drink your water. Time out. To ask for that time out and come back. So if someone comes and says something that completely knocks you off, and say, I have to say, I hadn't thought of, I didn't quite see it that way, or I hadn't anticipated this, or I don't see it this way. But you've given me some food for thought. I'd like to reflect on this and come back to you. Actually, can we set up another conversation tomorrow or next week or whatever, right? So using that sort of bow out gracefully tactic when it comes to those power moves is extremely important. And I have to tell you, it really is, this whole thing, it really is a process at the end of the day, right? So understanding that these, again, the fact that you're on a negotiating table usually means that there are more to come. Yes. There are more of these tables to come. Absolutely. And so
I just wanted to add one thing and to say, because when bowing out gracefully is certainly something you can do, but if you ever actually prepared to come back and you have a comeback for what was said to you, it's like, you know what, I appreciate the feedback, but you know what, this is the way I see teamwork in this setup. Or say, if you do have a comeback to that gut punch, go ahead by all means and deliver that comeback in a very calm and sort of measured manner. But go ahead and deliver it. If you're ready for it, go ahead. Right. If you're not, take a step back, realizing again that this is not the end of the process. Come back another day. But if you're ready, please go ahead and deliver it. As long as you can compose yourself and maintain sort of an emotional less type of discourse, then by all means go ahead and do it.
Absolutely. Okay. So to recap, yes. So we're getting to the fun part of it.
Yes, we're getting to second half hours. So just to recap what we've covered thus far before we get into the fun part of things, just to summarize. So we have talked about reframing, the importance of reframing, of seeing that first image and evoking something evoking opportunity, right? As opposed to negative feelings. We've talked about the pregame work, the importance of depersonalization, realizing that everybody goes through this, knowing your value, understanding how to leverage information and how to leverage your networks. So you learn as well more about the negotiator that you're sitting across, and then your tactical planning. You practice, you show up for game time. We've discussed what your research tells us as to how to package our ask. And then what are those recovery maneuvers that Sausan so expertly explained to us when we're knocked off our feet a bit? How do we just not fall down and we again come back to another day? Or how can I pivot here?
Right.
And of course, we've talked about the importance of practice. So we are now going to go ahead and
yes, we're going to enter the scenarios,
practice.
Which is the fun bit.
Yes.
And so we have a couple of scenarios that we've prepared. I don't think any of these scenarios are going to be surprising to anybody. And we have some brave volunteers,
very brave,
and colleagues who have volunteered to actually walk through these scenarios with us. And so our first scenario here is called "Let's Get Personal." Mm-hmm. I'm gonna run this one, and I'm gonna have Dr. Leila Abdelwarid. If you're online, can you please unmute yourself?
Hello, Sausan, can you hear me?
Hi, yes, we can hear you, Leila. How are you?
Perfect. I'm good. Good evening, Sausan. Good evening, Pascal. Enjoying this session tremendously. Thank you very much.
Thank you, and thanks for being willing to participate. So here we go. So you are a physician that's been around for 8 years in the same institution. You've led many successful initiatives, and you've improved many things in your work, and you've consistently received accolades and done well in your annual appraisals and so on. And then the position opens up as a section head in your department, and you've expressed interest in the position. So you are now meeting with me, the chair of the department, for an interview. And I will start off by saying that whatever this is Dr. Leila, this is really impromptu, right? We haven't rehearsed anything. So this is really impromptu, and anything I say is
and it's fictional.
It's fictional.
Yeah.
So whatever I say, it's absolutely fictional. So Dr. Leila, it's so nice to see you.
Thank you, Dr. Sausan. Thank you for having me.
Yeah. So I was so happy to see your name as one of the applicants who's interested in this position. So tell me.
Thank you very much for this opportunity. Actually, I'm interested in this position for 3 main reasons. The first thing is I think we can turn this department from good to great. I think my past 8 years with you have proven this with the many projects they came my way, and I completed them with success under your leadership. And I really do believe that we have opportunities that we still ahead of us that we can seize together. The second reason why I'm interested in applying is I think we are also going through a lot of changes right now. I believe I bring stability to the department. I have good relationship with my colleagues, and I think I can lead them through the change and hopefully help them get over this transition successfully. And the third reason why I want to do that is that, as you know, quality is a very important aspect in all of what we do. And I believe I can bring about even more improvements in the quality of our operation and bring about even more achievements in this regard.
Wow, I'm really impressed, as I have been for the last 8 years working with you. You're always prepared, and you have such great thoughts. And I completely agree with everything you've just said. It's exactly what we need. Dr. Leila, I've had such a great, it's been such enjoyment for me personally to watch you grow in these last 8 years, and I actually take you as not just an employee that reports up, but as a friend, as someone I care about.
Thank you, Dr. Sausan.
Yeah, and in that respect, and I hope you take what I'm about to say in the light that it's intended, is, I know how important other things in your life are to you, and myself being a mom, I know it's how hard it is to juggle, work and life and so on. And so I'm really concerned, you have 5 kids, and I know that you are a wonderful mom. I don't even know how you do it now, to be honest. I only had 1 kid because of that reason. So my question is, have you really considered if this is really the right thing for you?
Well, that's an excellent question. Actually, I have got a very good system working for me, and I'm actually really, really blessed that it is. And thank you very much for your concerns about, my work-life balance. But I think I came to a resolution together with my husband that work-life balance to us means enjoyment and fulfillment. And as long as we're enjoying and fulfilling in all areas of our lives, whether it's professionally or personally, I think we're happy. So in that regard, sorry.
Yeah, I don't mean to interrupt. I don't mean to interrupt you, but I'm just thinking, it seems like whatever arrangements you've made have worked well for you in this current position. I think you may not know, in that next position, really, it's going to be very externally facing. It's going to require really long hours, and you kind of don't know what you don't know. I can tell you, to take it from me. It's going to take more than whatever you currently have at home. It's really a daunting task, really. So I'm worried. I'm concerned for you. And I'm being honest, this is one of the things that I'm concerned about. And I have no question about your competence, nor the ability of your husband to support you. It's just, it's a place you haven't been.
Oh, thank you very much, Dr. Salson. Again, I know that this is a very important aspect, actually, not just for women, but for men as well. But if you remember, one of our projects together was the Cerner transformation project. If you remember the amount of hours I put into that project, it was very, very tight timelines. We were doing this through COVID pandemic. Everyone was stretched, yet we did a major transformation of our information system together. I put in lots of hours. I didn't come to you complaining or struggling with trying to balance my duties around this project. I do appreciate, though, that sometimes the work gets really tough and you just have to really dedicate your time to your work, and then things balance out eventually. So that I feel I'm comfortable balancing around. And as I said, as long as I'm enjoying working with you, and as long as I'm enjoying working with my colleagues, and as long as we are achieving great things together, that all doesn't count. All the hard hours doesn't count. Yeah.
Thank you, Dr. Leda. That's actually really helpful. Thank you for those insights. And, we'll be considering you for the position for sure. So thank you, Dr. Leda. So that's the end of the scenario. And my gosh, Leila, you really came prepared.
Thank you. Oh God.
She did some free work.
Oh, wow. I'm promoted.
So I have to tell you, we're going to debrief just for a second. How did that feel for you? And tell me.
Yes, absolutely. So, that challenge with the children, to be honest, is an interesting one. And then the fact, I tried to defend it, but then you came back again and tried to put it back in perspective. And I think I just wanted to divert you to focus more on what we've achieved together at work, just to get you out of that thinking about it.
I like that tactic. I thought you did a really good job with that. Okay, let me remind you of this, of this particular project. And that's really nice because it's extremely practical. And you highlighted exactly the areas that were addressing my concern. And most importantly, you didn't lose your composure, though. At some point, you said something about men in the middle, which is interesting because it could be like, taken as a like, whoa, but you did it so well. You weaved it in well, and you actually said to me also, you ended it really nicely with as long as I'm working with you and I'm happy. So really fantastic job. So having said that, we do have a poll out. Thank you, Dr. Leila. You're all free to go now.
I think she won that negotiation. I think you won that one.
So we have a poll up. And the poll is going to ask you essentially, thinking of this scenario, we'd love to hear your ideas about what you might do in this scenario.
Yes.
So we're going to give you about a few minutes to vote, and then we'll see what did people think they're going to do.
Great.
So
go ahead. You had 4 options. Go ahead and pick the one that makes most sense to you.
Give it a few seconds, and then we'll once we get enough results, maybe we'll share the results.
Yes. So go ahead and make your picks, decide which way you would go with this. Right. We're not seeing the poll results yet. Maybe people are still voting. Here they come. All right, so let's see. Shall we go from
I think there's really just one here, 80%, right?
Yeah.
Voted that the concerns about ability, you can read it actually.
So 80% of the participants mentioned that they would answer the concerns about your ability to balance work and personal responsibilities.
So you would take it head on.
So you would just go ahead and address it, keep your composure, and just take it on.
Yeah. That's basically what Dr. Leila did, right? So I think she set a really great precedent.
Yes, I agree.
So that's great. So I think what we'll do, thank you everyone. So we're going to move on to the next case.
Yeah.
We have a few minutes as well on the next case, and Pascal's going to take that one.
Take it away. So case number 2 here, we have another brave volunteer. We have another brave volunteer. We have Dr. Nicole, who's going to go ahead and unmute herself.
Good evening, everyone. Thank you very much, Dr. Pascal and Dr. Sowson.
Hi, Nicole.
And thank you so much for joining us, Nicole. So here, I'm going to go ahead and read the scenario, and then we're going to go ahead and start. You're a seasoned healthcare executive and have been advised on a new opportunity that will expand the current scope of your work to include the establishment of new healthcare services and will require advanced executive leadership skills. Though you are interested in the job, the financial compensation for this role has not been discussed yet. You are now meeting with your potential new boss. Hi, Nicole. Thank you so much for coming to meet me today.
Hello, Pascal. Thank you. Thank you for inviting me.
So I have to tell you that I've been through, I mean, I know you, but I went back and went through your experience and what you've achieved. And I'm so impressed with what you've been able to achieve thus far, Nicole. I mean, really, your work speaks for itself. And I have no doubt that you would do a really good job in this new role.
Thank you very much. I agree that much of the work that I've done so far would lead well into this, and that I've shown that I've been able to start new service lines in other areas. And I think our partnership would be able to foster expansion and further development. Absolutely. So I appreciate this. I think that, as I'm thinking about this opportunity, I recognize that I've really brought a lot of commitment and value to the organization. Sure. And I know that I can continue to bring that. And that comes with, of course, my own commitment, which is very strong. And I hope that I have that commitment back from you and back from the organization. And so I'd like to talk further about the details of this position, including the compensation and the structure of the salary and the benefits that go along with it.
Yeah. So again, I want to, the more I think about you, and I tell you, I've been watching you for a while now, Nicole, and I can see this new opportunity as really an inflection point in your career where it's really going to not only allow you to grow within the organization, but really facing other external stakeholders. So I see, I look at you now and I see myself 15 years ago when I was in that position. And I'm really excited to be able to see you sort of take that plunge in what is going to become a remarkable growth opportunity for you. So I can't begin to tell you how excited I am about this opportunity for you and for the organization.
I agree. I'm glad we're mutually excited. So I think it will be helpful for us to talk through some of the details so I can consider my options. And I think understanding the value that I've brought to the organization, as well as what this new position would entail from a responsibility perspective, I think that my compensation should be around $500,000.
So listen, we can talk about the nitty gritty. I think with HR can address that, but I really don't see this as sort of a numbers thing. I think really is the potential for you is what I'm seeing here. And what I would like to stress to you really is that inflection, Nicole. Do you understand what I mean?
Absolutely. I see that potential as well. But again, as I think through my commitment to the organization, I want to make sure that I have that commitment back.
Yeah. And you have my full commitment. I mean, I'm backing you here. Absolutely. You have my full support in this new role. Absolutely. You can count on that.
Great. So where do we take these discussions further?
So from my standpoint, we can, if you feel comfortable with moving forward.
Well, again, I just want to be able to talk through the details with you. So if we have, maybe I could reach out to the person in HR that you're discussing and we could circle back for a second meeting.
Oh, that sounds like a very reasonable next step. Yeah, if you want to do that, that's fine. Like I said, you can circle back and have further discussions. Absolutely.
Great. I appreciate that. As I said, any new opportunity, of course, I balance with my own goals and that of the organization. So I just want to make sure that this is in line with that we're both aligned on what that looks like from a comprehensive perspective.
Okay, very good. That sounds like a reasonable thing. But again, I don't want you to lose sight of the big picture here, Nicole.
Absolutely. No, the big picture is there. And, but I'm confident that we'll be able to come to some sort of agreement together that's mutually, that values the work for what it is and values me for my role. And at the same time provides me with those opportunities to help the organization grow.
Very good. I couldn't agree more. Thank you for your time, Nicole.
Great. Thank you. Looking forward to our next meeting.
Absolutely.
Oh, wow.
All right. So Nicole, how did that feel?
Very frustrating. It was tough because, I couldn't get you to commit to talk about it, and you deferred to HR, which at least would give me someone to come back to with some sort of number, since you were not seeming to want to discuss it at that time. But yeah, it was uncomfortable.
It's definitely uncomfortable. And I'm always amazed at how often this actually happens, right? Where it was somehow money never, or the financial package actually never gets discussed.
Right.
And then it's up to you to bring it up, perhaps.
And you were quite patronizing with the whole, well, I want you to, I want you to see the big picture here, right? And I was very impressed with Nicole's ability to just maintain her composure about that. And and I have to say, sorry. Yeah, I mean, sorry, Nicole, but yeah, I think you did a good job. So did you leave feeling that she was unlikable because she was somewhat persistent about
No. I think what I appreciate, I mean, she had a pivot where she was like, okay, I'm not going to get a word out of this one in terms of the financial package. And she immediately veered towards, okay, let me go to HR to see what I can get, what in terms of information that I need. Smart. And I think that was a really good pivot. I think maybe that's one of those maneuvers that we talked about where you're like, okay, this is not going this way, I'm going to go that way with it. Right. So I think you did a really good job, but let's launch the poll and see what our audience is thinking.
No, thank you, Nicole.
Thank you so much for your participation. So we're going to go ahead and launch the second poll, and you're going to be seeing the pictures on your screen. Very good. And the question is the same, is which of the following strategy would you employ at this point? Depending. So please go ahead and read the different options and tell us.
And you could use a completely different strategy from Nicole's, right? So it's about just generally knowing this scenario. What do you think you would have done?
Yeah, what would you have done? Exactly. Right. Okay. So this one actually has 5 different options. So we're going to give everybody a minute to read them and to pick their choice. People are still voting. We'll give everybody a couple more seconds to come up with their answers.
Okay, I think we can show the results.
Yes. So let's see. Do we have? Very good. Indeed. Here are our answers. So this is more nuanced than our last one. So 40% of you said that you would give a range of salaries that would be acceptable to you. So you come out there and just state the range of salary.
She gave the $500,000, like
she did give a number. She did give a number. So 40% of you said that, and then after that, it's split between asking for a follow-up meeting at a later time versus wait until the chair proposes a compensation package without actually bringing it up, hoping that the chair actually brings it up at some point.
And I really appreciate the audience's honesty here, because I think that is actually something, it's unfortunately not something very successful, you know, because we do hope like, okay, maybe if they come with something, then I'll open the topic. And oftentimes they don't come with anything, right? And then next thing you know, they're like, okay, so here's the salary with, here's the position with no change in salary, right?
Right.
So and then you're put in a sort of more defensive position rather than coming to an agreement. And I think that's the avoidance stuff that I know I've done in the past, and many of us have done. But again, we're hoping that, you know, you feel more comfortable over time. Again, this is all practice to be able to actually use another technique. So I like the regrouping too, which is like, this person is being really avoidant, doesn't want to talk about money. What am I going to think about? And it's okay to go back and say, oh, you know what, this has been really, I feel really encouraged about your enthusiasm for me as a candidate. And I'd love to think about it a little bit more and come back to you. That's okay. That's okay.
These are all good tactics.
Fantastic. So I think we can, so we're going to wrap it up.
Absolutely. We've come to the end of our episode here.
Yes. And so what we've done is, if maybe we can move forward. So what we've done is we've provided you with some references, really quick, easy reads. And there's a great podcast on there as well that is geared towards female physicians, but actually could very much be translatable to anyone in healthcare, really. And so we hope that they come in handy. And what we're going to do next is we are going to go into that segment of ours. Before we do, we're putting up for you our contact information. If you'd like to continue the conversation on social media, you see both me and Pascal's contact, and you also have Dr. Nicole's contact, because she is going to head the next segment that we're entering. So you may want to also follow her. So in this next segment, what we're doing is highlighting essentially a female leader in healthcare. And it's always such a pleasure to do that. And also highlighting some unique services that are related to women's health or diseases that predominate amongst women. And so I'm going to quickly introduce to you all Dr. Nicole Cerullo, who you've already met in this last scenario. So Dr. Nicole is the chair of preventive medicine and a leader of the Center for Healthier Living. It's a comprehensive lifestyle medicine program in the Oncology Institute here at the Cleveland Clinic Abu Dhabi. And over the last 7 years, Dr. Cerullo and her team have built the executive health program and the lifestyle medicine program at CCAD, incorporating evidence-based lifestyle interventions to prevent, treat, and reverse chronic disease. Dr. Cerullo is also a clinical assistant professor at the Cleveland Clinic Cerner College of Medicine. So thank you so much, Dr. Cerullo, for being with us here today. So I will ask you, if you don't mind, we're going to ask you to unmute yourself again and maybe open her video. I don't see Nicole.
Can you hear me?
We can hear you.
Sure. Yes, absolutely.
So
tell me, Nicole, before we get started on the live, there you are. So before we get started on the program, tell me a little bit about your own personal journey to your professional role.
Thank you both for inviting me. This is much more comfortable for me to talk about than negotiating with Dr. Pascal. So I really appreciate that. I came into really caring about lifestyle medicine and prevention, I think, from very early days. So I appreciated this question to help me think through how all of the pieces came together. Because it was definitely not a straight line. And I really had a very formative experience when I was in college and university. I spent a year in China studying there, and I learned some traditional Chinese medicine and really got to see many, many people in need. So this is where I decided I wanted to be a doctor, and was exploring actually even naturopathic medicine and other alternative paths. And then throughout medical school, again, I had these two themes that really worked together well. And that was really caring for the underserved and learning about how people take care of each other in lots of different cultures. So I had another year where I spent in Ghana and Guatemala and Mexico, and really kind of understanding how different people took care of themselves. And then that brought me into internal medicine and really looking at primary care and it from a different perspective. And a lot of the work I did in New York before moving to Abu Dhabi was really, again, taking people and trying to meet them where they are. And I think that is the kernel of what we do in lifestyle medicine, is we try to help empower people with tools that they can use to help improve their health. And so it was extremely useful for me in that setting to try to help people along that path. And I have found that in Abu Dhabi, as all of us know who are here, we have a chronic disease, rampant chronic disease, and people are really looking for ways to help improve their health, and they just need the tools to do it.
That's such a fantastic journey. It's so colorful and really adds so much. Honestly, it just adds so much to what I understand that you do. So that's fantastic. And I'm wondering, can you tell us a little bit more? I know you mentioned sort of the core of lifestyle medicine, but can you tell us about lifestyle medicine specifically as it relates to the prevention of disease?
Yeah. Sure. So moving forward, you can see their lifestyle medicine really applies to 6 areas of someone's health. Can we just go to the next slide, please?
Sure.
And the first one is healthy eating and physical activity, managing stress, tobacco, alcohol use, improving your sleep and your relationships. And I think what we're trying to do is meet people where they're at and help them understand that it's what they do every day that's going to help improve their health, not what they do every once in a while, right? So really trying to get those habits every day. When it comes to breast cancer prevention, these are really primarily going to be adhering to the Mediterranean diet in whatever form that is for your culture or for your food. It's high fiber, higher in fruits and vegetables, low in saturated fats and processed food. Exercise at this point is the most data-driven way you can prevent cancer, full stop. And if you do develop cancer, it's the most potent way that you can help reduce your risk of recurrence. Stress.
You're saying some really key things. I know you're going fast because the time, but wow. Yeah, no, that's really, I mean, I think it's eye-opening for many people, right? That what you just said, it's exercise, right? It's exercise.
Exercise really at this point is the most data, that has the most data behind it. The Mediterranean diet, there was a very large study looking at women, and they were randomized to 3 groups. One was just a standard low-fat diet. One was the Mediterranean diet plus nuts, and one was Mediterranean diet plus olive oil, extra virgin olive oil. And the women in that group, Mediterranean diet plus extra virgin olive oil, had a 68% less incidence of breast cancer. So there is a role for diet. It's there. But exercise is even more potent. And I find that the data on breast cancer recurrence, so if any of you have family members or friends that you know who have been touched by breast cancer and are experiencing going through breast cancer treatment, exercise is one of the best things they can do to reduce the risk of recurrence and dying from the disease. There is also an association with sleep, and recently more studies have been looking into actually using some melatonin because there is an association with having too little melatonin and developing cancer. And then, of course, there's an association with too much alcohol and breast cancer. Stress and relationships have their role. Of course, it's much harder to study those, but there are studies looking at social isolation and women with breast cancer having higher rates of mortality and doing less well with their treatment. So all of these components are important. And this is what we try to do with our breast cancer program that we have at CCAD. Which is a lifestyle medicine program really focused on women who have completed their treatment with breast cancer. And we have developed a very nice program within the Department of Preventive Medicine. Dr. Rahat Ghazenfar is also very involved in this as one of the leaders and physicians. We work with our dietitians and our sports therapists to really help people move through their behavior change onto healthier habits.
Wow. So there's just honestly, the 5 minutes are just not enough, but it sounds, so can you tell us where can people go to find more resources, and are these services available to everyone who suffers from breast cancer?
So at this point, we have the ability to see everyone who comes in through Cleveland Clinic Abu Dhabi's oncology program after their breast cancer treatment. Once the new building is open, we will have the Center for Healthier Living located on the ground floor, which will have these services available for every patient with cancer who is getting their treatment at Cleveland Clinic Abu Dhabi. More information on lifestyle medicine can be found at the American College of Lifestyle Medicine and the International Board of Lifestyle Medicine if there are other physicians who are interested in getting board certified.
Absolutely.
Wonderful.
That's wonderful. So we're going to have to wrap up.
Yes.
Thank you so much, Nicole, for your expertise and insights. And we're going to go to the next slide.
Yes. If you want more information on the Breast Health Clinic, you can scan this barcode, and there is the phone number along with the Cleveland Clinic internet site where you can get all the information that you need.
Yes. So this concludes this episode.
This is it?
Yes, it's been fun. I really, really appreciate our audience members and our volunteers.
Yeah.
And we look forward to our next episode,
in
which will be in
December.
December. So stay tuned. Another topic related to women in healthcare.
Another hot topic coming up.
And we appreciate your time. So have a great evening.
Thank you very much for participating.
Take care. Bye-bye.
Bye.